Welcome to Guide Guru. We hope this video helps.
You start by positioning the roller under the target muscle, calves, hamstrings, or upper back, and sitting or lying with support. Apply light pressure first. Pain should be tolerable, not sharp. Once done, slowly shift weight to explore tight spots for 1-2 minutes each. Make sure to breathe and relax the muscle while you roll. This reduces guarding and increases tissue glide. Keep movements slow and controlled, about 3-5 cm per second, and stop if numbness or severe pain occurs. Once you locate a tender knot, hold steady pressure and perform small oscillations, about 5-10 seconds, then continue rolling to mobilize surrounding tissue. You should use your arms or opposite leg to modulate pressure. Leaning more increases intensity, and stepping back eases it. Make sure to include both longitudinal and slight transverse strokes to break adhesions and improve circulation. Continue for 5-10 minutes per muscle group, pausing to assess range of motion and comfort. You finish the session by easing pressure and performing light rolling for 2-3 minutes, then follow immediately with gentle static stretches to consolidate gains. Make sure to hydrate and avoid intense activity for 15-30 minutes so tissues recover. If you notice increased sharp pain, tingling, or numbness, stop and reassess. Reduce pressure, change angle, or shift to a softer roller. If symptoms persist, consult a clinician. Otherwise, maintain a regular routine to prevent recurrence and track improvements in mobility.
Thanks for watching. Consider subscribing if we helped you today.